I'm Trish Power Scott.
And I'm Lynn Loria.
Welcome to Two Cents of Sunshine. We have our special guest, Sam Gomolka, back today, and we are going to finish our talk all on hormone replacement therapy. But I have a surprise for you. We have just talked her into coming back to our show to talk about my favorite thing. If you know me in the world, peptides. I'm obsessed. I can't stop. So she will be back for another round at some point. But today we're going to finish our talk all about hormone replacement therapy. Thanks for joining us.
Thanks for coming back.
Thank
Thank you for having me.
Thanks for being here. So last time we ended and we were talking about, how do you actually know when you're ready to go and take and have hormones, and, when do you take your symptoms seriously, and all those things. So if we want to start back up where we left off, we were talking about even the smallest symptoms start right away, right? And that's how you can avoid things in the future.
And to start earlier, I think the mindset is to start earlier versus later. Yeah. And I think, everyone accepts oral birth control, right?
Right.
Contraceptive would give it to teenagers and whatnot. That is such a higher level of hormones and medication than bioidentical hormone replacement.
I'm so glad you said that because I've switched birth control recently. I take an oral pill and it just annoys me, right? I have to get mine is non-hormonal, so I have to take it at the exact same time every day or it's ineffective. Could you imagine me having a baby at this point in my life? 41 years old, I almost be 42, would not be ideal. So they switched me to the NuvaRing, which is heavy in estrogen. Oh my gosh, I had that thing in for like 2 weeks and I was dying. I had to take it out. I immediately, I felt like I was pregnant. Like my boobs hurt so bad I could barely function, and moody, nauseous, like all these crazy symptoms from estrogen. So it does kind of make me afraid to take it. But is it they give you certain doses? Like do they give you a blood test? Do you do a blood test and then they know how much to give you? Like, how do you figure out your dosing and how much you're supposed to take?
So I think we should talk about what absolute contraindications are for hormone replacement. So if you have suspected pregnancy, if you have unexplained vaginal bleeding, if you have history of estrogen or progesterone receptive sensitive breast cancer, if you have history of clotting disorders, cardiovascular disease, stroke, DVT, pulmonary embolism, or if you have active liver disease, birth control is not for you. Not birth control, hormone replacement therapy. Other than that, so there's a much different approach from a perimenopausal female versus a menopausal female. So perimenopausal females have wild fluctuations in your estrogen and progesterone levels. Your body is sending signals to your ovaries to make as much as it can, but the response is variable day to day. So the new data is that we don't do labs for evaluation of
Oh, interesting.
Okay.
Okay.
I'm glad I just said that because I'm going to go off that point after you. And that is supported by the leading menopause doctors. So Dr. Mary Claire Haver, Dr. Rachel Rubin, Dr. Heather Hirsch, Dr. Kelly Kasperson, Dr. Vonda Wright. Those are leading physicians who are at the forefront of this menopause revolution. And it's just at this point not evidence-based. Now, if you're starting testosterone, that is a controlled substance. So you do need a baseline testosterone level. And then also you get one 6 weeks later-ish just to make sure that you're absorbing it correctly. Estrogen, so you have systemic, so that would be either oral or transdermal. I don't really love the oral version because that can activate clotting factors. There's something called first pass metabolism in the liver. So typically for most patients, I do a transdermal approach, which would be either a patch or a gel. And there's different strengths. So if you were going into perimenopause and I suspect that you're still having estrogen, I would start you on a lower dose. And there's 4 different doses that I can pick from. We would start and reassess. So symptoms of high estrogen would be breast tenderness, abdominal bloating, breakthrough bleeding. And so when you start this, we really reassess your symptoms at the 4-week mark.
So those would be symptoms if you had too much estrogen.
Yeah, where we need to take it down a little bit.
Take it down a notch.
Perimenopause is tricky. So
Yeah, it is.
straight menopause after a woman stops having her period, that's much more straightforward in a treatment approach. I typically do a higher dose of estrogen, typically the 0.1 milligram patch, along with progesterone if they have a uterus, because that is the level that is protective against bone, it's protective against cardiovascular disease, and also cognitive decline. The perimenopause still cycling females, they have their own hormones at play. And so you're trying to find that sweet spot where you're offering adequate endometrial protection with the progesterone, with also giving them a dose of estrogen that will alleviate their vasomotor symptoms and just restore them back to themselves.
A lot of times a lot of times I would become a little bit frustrated when I would talk to women who would go to their GYN or to their primary care, and they would tell them about their perimenopausal symptoms. And the doctor right away would say, we're going to do some blood work. And correct me if I'm wrong, but in a 30-day cycle, it's going to shift if you're
So different.
so they're coming back to me and talking. They're like, I'm so frustrated. I have all these symptoms still, but they said I'm in the normal range. And I'm like, you'd have to do blood work 30 days in a row, I think, to get an indication that is accurate of what your hormone levels are. I also, which hopefully you can help me understand, I've had some clients that are more about your age, starting perimenopause, and instead of the doctors putting them on maybe a low dose estrogen, like you said, they're starting them on birth control. And I'm thinking, that's a higher dose. I'm not understanding.
A higher dose, and it's also synthetics.
Mm-hmm.
There is an indication. So as you transition through perimenopause, a lot of women can have heavier vaginal bleeding, more clotting, leaking. You go, gosh, I haven't bled like this since I was 16. What is going
That
on?
happened to me.
Mm-hmm.
Yep.
That
Bad.
happened to me. I worked at the office across the way, and I've seen patients. I went into my office, and my MA comes into it. She goes, "Are you okay?" Oh yeah, I'm fine. There's blood all over your stool. You do
Yeah.
leave
Yeah. That
in the
happens.
patients to run to
Those
Target.
fun days.
And they were very
Yeah.
mortified.
Yeah.
I think we've all been
Mortified.
there.
Yeah. Oh yeah.
Yeah. So cancer was,
Was that before or after?
it was before. Now, knowing what I know, looking back on things, I was in perimenopause way before cancer happened, and I didn't understand
And how
what it
old do you
was.
think you were during that when you first started having symptoms?
Probably around 40.
Right around
So
40.
even I had joint pain. I had a whole workup for rheumatoid
Me too.
arthritis. I
too.
was like, how can my ANA be negative, but I'm having. So I would go for joint injections, but every
Same.
month.
Same.
Do
Yeah.
you know that since I started estrogen, I haven't
No joint.
No problem.
none.
Wow.
Same.
And that is something called the musculoskeletal syndrome of menopause. So a lot of women come up with either joint pain or frozen shoulder.
Mhm.
Well, I've heard that
Yeah.
term.
Yes.
Yeah.
Yeah.
Interesting.
So
Isn't that something that I did? I went to a rheumatologist.
Yeah.
Like I know, I mean, my joints were just, I remember a Thanksgiving and I always host it. And I remember taking and just trying to get through the best I could, taking the turkey out of the oven. Everyone left. I cleaned up and curling up in my bed, crying.
Yeah.
For an hour because I was in such severe pain. It was all my joints were just like flaring in pain. It's a real deal.
That's crazy.
Yeah.
I've
So
never
wait.
experienced that. I mean, yeah, that's why
That's I don't know the sweet spot to where, like, when Trish is saying,
Right.
should I be proactive now and not getting to a point where the symptoms are so severe?
So you mentioned that you're on birth control.
Yes.
You would have, it would be,
What's one or
why
the other?
are you on birth control? So
Right.
if it's for a contraception,
Yeah, that's the
then
same reason at this point.
okay, so that would be something that you would have to come to a point where would you want to transition off and get on bioidentical?
But that does not protect you in
It
any
does
way.
not, it does not, and particularly during perimenopause, women can get pregnant.
Oh yeah.
Certainly,
I think that chaos of that. I'm gonna be thrilled.
Maybe a
She
girl.
wants a girl so bad. All these boys. But yeah. Okay, so there has to be another answer for the birth control factor.
there would have to be another method. Yeah.
Yeah. Okay. That's interesting and good advice. Had no idea that was a
Yeah.
thing, but that makes sense. You can't keep putting other
Yeah.
hormones in your body if you're replacing the ones that you're supposed to have.
But the ones that you're on for birth control are synthetic. So those are not bioidentical. So if you've been in a mindset where you're okay being on birth control, then you should welcome replacing something that your body naturally makes but is declining.
So when you say bioidentical, in my mind, that goes to amino acids because I'm so used to the peptide talk. What actually is bioidentical? Is that made up of the same things in your cells?
It's a good question.
So it's the same version that your body makes.
Makes already. So
So-
synthetic, my mind goes to fake. So synthetic is a pharma, it's a fake, right? Okay. And that is one of the things about peptides in things that we take hormone replacement. For me, again, with these theories that you come up with in your mind, anything that's fake or pharma, I won't do it. I don't do it. I don't take anything. I won't even take when I'm having these bad anxiety feelings, I have Xanax. I could take it. I won't because I think that you're masking, you're band-aiding the problems instead of dealing with them. But then some days, I'm not saying don't ever take it. I'm saying some days it's bad enough where you just do it and take it. But I feel like when you put the fake things in your body and then they're processing through your, wherever they're going, through your liver, your kidneys or whatever, and we have too much, then that's what's doing damage. But in bioidentical, if you have too much, you just pee them out,
There's a lot to unpack there. For hormone replacement therapy, a bioidentical version of estrogen would be 17 beta estradiol. That is what your body makes. So that is what bioidentical. And bioidentical can mean FDA approved. So I'm using hormones that you can get from your commercial pharmacy.
Oh.
Bioidentical is different than compounded. Compounded is made in a compounding pharmacy. So the progesterone, I'm using micronized progesterone for most patients. If you have a peanut allergy, micronized progesterone is not for you.
Interesting.
If you find that your symptoms are worse, you might have a progesterone sensitivity where a synthetic progestogen would be a better fit for you. So it's very patient
This is
specific.
really, really case specific.
Get
Yeah.
froggy. So understanding contraindications, applications, what are the symptoms? What am I treating? What am I afraid of? That kind of guides each visit. So it's very personalized.
So I'm going to ask you a question right now that every single person at home is thinking, is this what you're going to do? Are you going to be free to take on patients? And I want you.
Yeah.
So tell us about your new venture here.
So this just started as something to save myself, right?
Yep,
I
yep.
needed answers. I went to multiple providers. I didn't get what I needed at that time. There was a PA in Williamsville that changed my life. And she was the first one having this discussion with me about estrogen, progesterone, testosterone. And so from there, I wanted to learn everything I could. I had a friend who really believed in my mission. And so she paid for my education.
Unbelievable.
Peptide 1, peptide 2, weight management, integrative oncology, my hormone replacement, menopause certification. She really invested. So now it is what I do personally and professionally.
I love
So
it.
yes, I treat menopause coaching and care, so weight optimization, and then peptides.
Yeah, we are so God bless.
We are so blessed.
Yeah.
And I do have a question also that you talked about this whole, litany of different things that people were fearful of or that they had symptoms to have them to reach out to their doctor. But one of them, you said the last one was the fear. So how can we today, with the black box warning being removed and lifted last week, so if someone is still like fearful and they're like, I have been told by my doctor I am going to get sick. I have, history of breast cancer in my family. I have the history of how can you talk to them and have them relieve a little bit of that stress and get some understanding that that might not be a good enough reason
It's
to.
such a good time for
Right.
people to be advocates for themselves. So there's so many books out there, obviously, that Dr. Mary Claire Haver, Dr. Rachel Rubin, Dr. Heather Hirsch, Dr. Vonda Wright, Dr. Salis Whalen is a phenomenal expert on GLP medications along with H.R.T for treatment of menopause. Dr. Kelly Kasperson, there was a wonderful FDA testimony last July that came out where Dr. Rubin and Dr. Kasperson testified, and they were integral parts in getting that black box removed. So those physicians, I think, are really leading the way. They all have a very heavy social media presence. So even if, reading their textbooks isn't for you, I'm a learner. I love reading if I could be a professional student. But they all have Instagram accounts, just little tidbits of information. Looking online, the FDA testimony is online. And understand that the first conversation you have with either your primary or a GYN may not go the way you want it to go. And it doesn't mean that they're a bad doctor. There's phenomenal doctors out there, but they may be more conventionally trained that have worked in the past 23 years where hormones have been bad, and medicine takes a long time to catch up. Typically 20 years is how long it takes to steer that ship. So knowing if you are empowered with information, then you find someone when they listen. And there's online, my company, there's MIDI Health, there's a lot of online telehealth communities and practices out there that specialize in hormone replacement therapy. And if only 7% of women are on hormone replacement therapy right now, there's room for everybody. There's room for everybody.
On that note, do you think, or do you know, is insurance going to cover these? So now that the FDA is saying, yeah, we're good, are they going to get paid for? I know for a while it's been out of pocket for a lot.
And I have great insurance. I have the top-notch insurance, and they do not cover
And they won't.
my estrogen cream or my testosterone.
But they would cover your estrogen if it was an oral pill.
I do take estrogen also, but this is for the localized, so the estrogen cream.
Oh, okay.
Only, they do not.
So
They cover Viagra. Fun fact.
Of course.
I don't know the exact number. There's like 27 different medications for treatment of erectile dysfunction. Females have.
Look at that real quick. I think 6 months, all those studies were done.
So to break that down, yes, hormone replacement therapy, estrogen and progesterone should be covered by commercial insurance. So my patients receive their medications through whatever pharmacy they go through. Bioidentical, if it's compounded, I know that estradiol or Biest cream, which is a compounded estrogen cream, is $197. for a patient.
Wow.
But if I send the estrogen patch to Walgreens, they can get a 90-day supply for $24. It's very insurance specific. It is what the provider chooses to send. So those are FDA approved, along with vaginal estrogen. Testosterone is not FDA approved for females. Males have the indication. Females can use it off label for a hypoactive sexual disorder, or HSDD. So typically, most practices, I would say, use a compounded testosterone cream. And the female dose of testosterone is 1/10 that of the male. So I prescribe 2% testosterone creams for my patients. There is also online pharmacies, and the H.R.T club is one that you can send a prescription. There's a membership fee associated, but they give the actual commercial version, so androgel, to patients. And the females would use 1/10 the dose that a male would.
So there's options.
There's options.
So if you can't get what you want from your insurance, there's just options.
Unfortunately, at this point, testosterone therapy would still be cash pay for female patients.
It's not crazy expensive though.
It
Oh.
depends on where. I think it depends on the source.
Yeah. Okay. Yeah. That's interesting. I mean, mine is not. So I should probably check what I'm taking and make sure it's up to par. Now you're making me nervous. No. Well, this has been so great. I mean, I feel like we could talk for hours and hours about all of these things, but we are definitely going to come back. We might just change this to 3 cents of sunshine for
And I'm moving because I see that little light.
I know.
I'm kind of moving over.
And we're going to bring Sam back for the peptide talk. But if you'd like her information, how to get a hold of her, or you have any questions for us for our next episode, please.
That'd be fun.
Live?
Would be.
Yes, let's do a
Q&A.
Q&A. We can go live.
Yeah.
Look at that. She's hooked.
Can we do
She's
this?
staying.
3 cents of sunshine.
Yes, I think it has to be.
I know.
Tell us what you think. I think
Oh, yeah.
Yeah.
she's
the
a perfect
questions.
fit. I feel like I'm going to get booted.
The blonde or highlights them.
Just some along.
Don't worry, my hair is turning dark with the hormone problems in my body. So hopefully you can fix it.
We obviously need to go to lunch and work this.
Yes,
we do.
Which is what we're doing.
Yeah.
They get rid of this little light on my face. I'm trying to like dodge it.
I love engaging your core.
Yeah, I know. We're just exercising here. She's probably like, yeah, she got to go to the bathroom. She got to go pee. So
Thank you again for joining us. Clearly, we're having too much fun today, and we will see you next time.
thank you.